Next patient is a 17-year-old male who fell at a camp from a few feet off the ground and sustained this right olecranon and radial head fracture. CT imaging was obtained to better delineate the pattern. It showed a comminuted olecranon and radial head. He was neurovascularly intact. And he was taken to the operating room the following day for a right radial head and olecranon open erection internal fixation, as well as an LCL repair.
That's a nasty injury. When are you gonna get that? When are you gonna get that one moving?
So our plan was to splint him for 2 weeks because of the LCL repair. He was very unstable prior to the repair. And then luckily he's young. After 2 weeks, we'll take off the splint and get him moving as soon as possible.
What was unstable?
Everything. It was just like very. Yeah.
So Anna, what shoulder position do you want to avoid as you start his post-operative rehabilitation?
I'm sorry, what was that?
I said, what shoulder position do you want to avoid when you start his post-operative rehabilitation?
What shoulder position?
Yeah.
Abduction?
Yeah, because that stresses the LCL. And I mean, I think your x-rays look great just looking at them quickly, but one thing I've done is I've tried to augment that lateral side. You know, you can either, if it's really unstable, you can think of your internal joint stabilizer. You can also think of, you know, some sort of suture tape just as extra protection, especially as you start moving, because the last thing you want is an unstable elbow and have to go back.
Thank you.
So you can't, well you actually, you technically can, but it's very bulky and it's tough to stack the IJS on that plate. So that's definitely a great idea, because at 17, he's, you know, his bone was great, but he's done growing. So it's more of an adult injury. But yeah, this is going to be a real challenge to rehab. So tough.
That patient is a 6-year-old female, so that's both fall with the right